8, 9 years ago, a patient came to me who I'd known for 10 years with his chronic back pain. He said, my back pain's better. I read this book. And I'm like, what? Back pain can't get better from reading a book. I've been holding your hand for 10 years with this problem. What are you talking about? Anyway, holy crap. This explains 4 or 5 people a day in my practice. I started applying these ideas to people in my own primary care practice. And all of a sudden, people who had fibromyalgia or chronic fatigue, chronic back pain, or chronic refractory, meaning hard to treat migraines, they were getting better. Really? You've been to all these doctors and they haven't been able to fix it? You've even been to Mayo Clinic and they've done all the tests and nobody can figure it out? That's so fantastic. That means the problem is in your nervous system. I know what the problem is then. Let's get at it. So I've got a whole different attitude. What you have isn't a brain problem. What you have is a normal brain that has a learned behavior. There's nothing abnormal about this. Let's retrain your brain, but let's not tell yourself you're sick or you're ill. You're not broken. You don't have something wrong with you. You don't have an illness. You have some brain circuits. They developed outside of your conscious awareness, not your fault. You can't get better if you're going to blame yourself for this.
Hello, everybody, and welcome to the Real Work Podcast. I am so excited for today's guest. You're actually the first person that I've interviewed on this podcast. So I'm really excited. We have Dr. Brad Fanestil with us. Welcome.
Good morning. Hi, Maggie.
I'm so glad to have you. Good. I found you on YouTube, I think. I saw a couple of your interviews. I found your TED Talk, which we'll talk about for sure. And I love your YouTube channel. You make great content. And I have a little bit of like a OCD quality to me where I've learned from everybody. I've heard from lots of Mindbody doctors and I resonated the most with you. So I was like, I've got to get this guy on the podcast. So what I would love is for you to just kind of introduce yourself and how you got to where you are now and what you're doing now.
Thanks. Super happy to be here because I just love talking about this.
Yeah.
I've been a primary care internal medicine doctor for 30 years. And most of that time was just absolutely just regular primary care in the hospital, in the ICU a lot, in my clinic, seeing patients. And about 8, 9 years ago, a patient came to me who I'd known for 10 years with his chronic back pain. He said, my back pain's better. I read this book. And I'm like, what? Back pain can't get better from reading a book. I've been holding your hand for 10 years with this problem. What are you talking about? Anyway, that led me to looking into this further, these new ideas in neuroscience about pain. I took some courses. I came back from my very first course in Santa Cruz. It was a weekend retreat taught by Howard Schubner and Alan Gordon. And I came back from that and just went, holy crap, this explains 4 or 5 people a day in my practice. I started applying these ideas to people in my own primary care practice. And all of a sudden, people who had fibromyalgia or chronic fatigue or chronic back pain or chronic refractory, meaning hard to treat migraines, they were getting better. It was astounding to me. And eventually I just said, man, this is incredible. I'm going to shift gears. I'm an old guy. I don't have that much time left in my career, and this is really exciting to me. I'm just going to shift. So for the last 7 years, I've been doing only mind-body medicine.
That's amazing.
And I actually joke now. I only see all the people I used to not want to see. That's
right. The unfixable cases where you're like, I don't have a solution.
Right. And now I'm like, really? You've been to all these doctors and they haven't been able to fix it? You've even been to Mayo Clinic and they've done all the tests and nobody can figure it out? That's so fantastic. That means the problem is in your nervous system. I know what the problem is then. Let's get at it. So I've got a whole different attitude now.
Well, what a blessing that is. Because I was talking to my husband about this and I'm like, man, the first point of contact when we start experiencing these symptoms, especially the physical, the pain ones, is our primary care. And I am so grateful for mine. He spent so much time with me and he referred me to a facial pain doctor and he referred me to a TMJ specialist and he referred me to a neurologist. And I walked out of there with gabapentin and Prozac. And I was off course for a while, right? And so I think often about this, about people being able to have that first point of contact, lead them in that right direction and how beneficial that would be for all of us. But I know it's going to be a combination of education and informing people, but it must just be so much more fulfilling for you, especially with these tough cases where you're like, what am I going to do if you just went to the Mayo Clinic? Like what other tools do you have available?
Right. Yeah. And I used to just have my bag of tricks and everybody tried them already. And I'm like, well, you've seen all the specialists. That used to be my thinking. What the hell am I going to do? I'm just your primary care now. You've seen all the, and now, of course, I've got this different attitude of we can rewire these neural circuits. And I'm wondering, just talking about going to your primary care doc, because I've just been thinking about this recently. In fact, it might be my next little YouTube video.
Awesome.
You think a bunch of people listening here get the concept that we're talking about? And what we're talking about here is neuroplastic pain, the idea that your brain can generate pain or can certainly augment pain. It can certainly, when we change our brain, our pain can change. That's not a new concept to people in your community.
No, my audience is definitely, what I talk about a lot is what happens when your nervous system just gets like sensitized, just to that point of you've been in fight or flight for so long, you're sensitized, you're experiencing lots of chronic symptoms. So they are aware of that. And we talk about what to do to get out of that. And I want to talk about how you work with patients. But what I don't talk about enough that I think you're amazing at is how do we get here? Like how does this happen over time? I think I talk a lot about neural circuits and changing that, but you're really great at talking about how the brain starts firing pain. I would love to hear you talk about some of that.
Yeah. So before I do that, just because we're on this little topic, this is such an important thing. I have so many people who ask me, how do I get my doctor on board with this? How do I introduce this? Because the primary care doctors, all doctors, we haven't been taught this.
Right.
And so this idea that they keep wanting to treat you like a car. They keep wanting to find the little thing that's wrong and do something to your body. And they don't recognize the connection here. But I think a great way for anybody out there who's like, I just want my doc on board with me. I like the guy. He knows what he's doing, but he's just and just a quick, simple thing that I think people can do. If you've had problems like this, if you go to your doctor and you say, I think some of my problems are because I have a hypervigilant nervous system, or I have too much sympathetic tone in my autonomic nervous system. You use sort of science language or doctor language,
right?
About the autonomic. I think my autonomic nervous system is a little out of balance and I'm a little too revved up. I think most primary care doctors are going to think, oh yeah, I know there's something like that. I didn't want to tell you it was in your head.
Right.
But yeah, oh really? You're working on that? Oh, okay. Yeah, I want to hear about that. So just coming to them and saying, I think that my nervous system's playing a role here. I think most doctors are going to be receptive to that. If you're trying to get a primary care doc on board. So
I do want to hear you talk more about the all in your head thing. One of the notes that I wrote down is it's common for people to go to their doctors and for them to actually say something that's like close. I've heard this in so many recovery stories where it's like, it's just stress. It's just anxiety. And they are so close, but it leads patients to feel very gaslit. And so I want to hear you talk about the all in your head thing and how we need to delineate between like what that means as far as things being created in the brain versus you're making it up, calm down and it'll go away.
Right. What people don't understand, the mind-body connection is incredibly powerful. And this is not, when you have, I see people with, for instance, irritable bowel syndrome, and they come in and they're like, look at this. And I can see their belly is out to here. They got a basketball in their belly and I can dunk on it. And I'm like, wow, that's full of air. It's not working. This is a physical problem. This is not in their head. It's right there. But it's not due to tissue damage. It's because you have a brain that controls your body. And it controls much more than just, I'll send a pain signal here. It controls everything. The lower part of your brain, I'll call it the lower part. It's actually, we have one brain, but it can be useful, and we can talk about that, to think about yourself as having two brains. But there's a large part of your brain devoted to taking care of your body. And it doesn't just take care of it, it runs the body. The autonomic nervous system runs your heart, your lung, your bowel, your bladder, your sweat glands, your hormones, your immune system. None of that stuff just happens. There is a conductor. It's in your brain, and you don't have any control over, any direct control. I don't have direct control over mine. Yep. But there is a large part of my brain running this, and it's controlling my gut. And when it doesn't work right, my gut goes out to here. That doesn't mean I have SIBO or it might mean, you might want to check some things, but once you've done some basic due diligence, usually these people have a problem with the way the nervous system is connected to the body. And so it's in the brain, it's in the nervous system, but these are very connected to your body. And we just need to change the approach. Instead of saying, let's look for another body problem, let's say we've looked at that. We've done our due diligence. Doctors are scratching their heads. Let me turn my attention to the brain and the nervous system. Not because it's in my head. It's because my brain and my nervous system are actually controlling what is going on in my body at all times. Right. And when I say your immune system, I'm talking about autoimmune disease even. What do you think runs your immune system? Your brain runs your immune system. It doesn't just happen of its own accord. And when you change things in your brain, you can change your immune system. You can change your hormone levels. You can change all sorts of things.
Do you
So,
feel like, from my learning in mind body medicine, at least over the last couple of years, as I kind of hyper focused on it, do you feel like autoimmune used to be something that was kind of like not in the category? Do you feel like that's more recently? I've seen people healing from all kinds of stuff.
yeah, and I've had enough anecdotal, seen enough people also heal their autoimmune disease that I'm so far down this rabbit hole. I'm like, of course, what I do want to be clear from, Western medicine likes data to its credit. I like that idea. And we don't have studies saying, hey, I got a bunch of people with lupus or some rheumatoid arthritis or whatever autoimmune disease, and I split them into two groups, and this group got mind body treatment, and this group got something else. We don't have that study. Right. I think we may at some point. I'm not waiting for it. We do have those studies with some other diseases, but having seen my understanding of how the nervous system is connected to the whole body and to the immune system, and having seen enough people overcome their autoimmune disease, I would never tell somebody, I want to be careful here. I don't want to take off a 30-year internal medicine hat and tell somebody who's dying of, lupus nephritis, as their kidneys are going south because of lupus. I'm going to put that person in ICU, and they need steroids, and they need immune blockers, drugs. But these people who are lingering chronically, and once you're out of that danger range, there's no downside to mind body medicine, and you can use it in conjunction with whatever else you're doing. Yeah. Changing your nervous system changes a lot of things in your body.
Yeah, I feel like I'm just seeing this umbrella of what can be put under it. Because when, you normally get into mind body world, and it's like IBS, migraines, just fibromyalgia, these things. And then one of the reasons I resonated with you a lot is because in multiple of your videos, you made reference to nerve conditions. And mine started with facial pain that eventually spread to my whole body. And you had talked about scalp dysesthesia and how sometimes we go to doctors and they give you a Latin name for something and you feel like you've got a diagnosis. So I appreciated those examples because they're not the standard ones that are found. But I'm just shocked at how many symptoms and syndromes are. It just feels like by the day you're hearing from people that are like, I had this thing and I don't anymore. But of course, there is a recommendation to get checked out by a doctor. Do you have a recommendation of where people start, or maybe more importantly, at what point they stop the tests?
Yeah, and that can be tough because you're a little bit on your own. If you don't have a doc who says it's time to stop testing, you've done enough stuff. Yeah. A lot of doctors feel like that, but then they don't have something else to offer you. So instead, they're like, oh, well, I do have a more esoteric test. Maybe I'll do that, because they want to give you something to look forward to, and they just don't have the narrative. So I do think you have a new symptom, it's lasted more than a couple of weeks or 2 or 3 weeks. You might want to get that checked out with some actual, medical testing sooner if you're, barfing or you're,
if it seems extreme
or something. But the due diligence doesn't usually take that long. So you can do a few tests. You can see a specialist or two at some point. When it's clear that the doctors, and most people have had this experience, the doctors are scratching their head, or one doctor saying one thing and one saying another. This has offered you a treatment and that didn't work. It is time, and part of this is taking control over your own nervous system. You're the boss of you. Nobody knows you better. Your doctor does not understand you and your system better than you do. You understand yourself, and people can start to be comfortable listening to themselves. What is my body telling me? It's telling me that something's going wrong here, and the doctor's telling me it's all in my head. That's not right. It's time to take a different approach. So I think it can be really tough when you're out there as a patient, and we've been taught that, the doctor's the expert. They know everything. They know a lot of stuff, but we're really good in Western medicine at making sure you're not about to die. Right. The bad stuff. We're really good at that. And if you have had something, and we sometimes miss stuff, and then 2 months later, like, oh crap, I should have found that. And I've missed stuff in my career. So these things can happen. But what I haven't seen in my career is somebody is a missed diagnosis that's gone on for 6 months, 6 years. If you've got something going on that long and you're not dead yet, Western medicine has done their testing. It's time to take a different approach.
Yeah, that's a big fear people have. I hear it a lot from people, like, what if they missed something? And to be honest, in my journey, I had to get to a point where I'm like, and maybe they did. But because I have seen everybody I can possibly see. We drive ourselves crazy because it always felt like there was another appointment, another doctor, another specialist, just something of like, this person may have the answer. And at a point I had to say they might have missed something. And if they did, I guess we'll deal with that when we find it. But there's some part of this where people they have to exhaust all the options a lot before they end up talking to someone like me or someone like you, unfortunately. And, I've talked with my husband before of like, how do you help people sooner? Is it possible? Are we heading in that direction to eventually be able to help someone when they're like, I've had a week of or a month of these symptoms? It's hard for me because I feel like people have to burn out before they get here.
Yeah, people have to, I think, come to a point where they understand just how limited the system is. I mean, I'm pretty cynical about I'm a Western medicine doctor. I'm not cynical about Western medicine in general. I think it saves a ton of lives. It's a great thing. I'm not opposed to Western medicine. Are you kidding me?
Yeah.
But it does have a limitation, and people have to realize this. And I think I'm hopeful that over the next generation of doctors, I talk to current medical students who immediately they hear me talk once, or they hear these ideas, and they're like, "Oh yeah, this is it." I hope we're undergoing a paradigm shift. And, people say, well, paradigm shift doesn't happen when you get people to change their mind. It happens when the old generation dies and the new generation comes in. So I'm hopeful that's going to happen over the next, decade or so. But right now, I think what people have to do, if you're in that area, if you're wondering, is this real? I don't know. I think so. Is keep exposing yourself to these ideas, because these ideas are out there now. If you go to the website symptomatic.me, symptomatic.me, that's the American or the Association for the Treatment of Neuroplastic Symptoms. That's one place to go. There's a lot of places to go. My website, I've got a little handout on the helpful handout stuff with lots of resources. There's all sorts of places to go for this. But once you do that, you start realizing, wow, this is all over the place. This is not Dr. Bozo in Boulder coming up with some weird idea. This is the new neuroscience, but you have to go get it. It doesn't come to you. You're not going to be watching YouTube and over here it's going to say, fix yourself for almost nothing. That ad isn't going to come up because it doesn't cost very much. Well, the ad that comes up is the Laser Spine Institute or the red light therapy or the something else or some supplement that you must be short on because somebody can sell you a product. This is something where you fix yourself, and it's not, you can't make a ton of money off it, or nobody can. Yeah. And so it doesn't come to you. But once you go look, you realize, oh, there's a lot of people talking about this. So keeping your head in the game can be a really important part of building your confidence and hearing stories and going, oh, wait a minute, that person sounded just like me. Okay, wait a minute, maybe this is real.
Yeah, it's like there's two sides of that too, because it's not only, is it not going to come find you, but I'm sure you've found, probably not in the work that you do now, but a lot of people also don't want to hear it at this point. They would like to go and have the doctor give them something that solves this. This work is not easy. It's very challenging. So I'm hoping that is included in the new paradigm where it's so well known that people are like, this is what is happening. The migraine is not the problem. It is evidence of something else going on.
Yeah. And I think, and I hope we can teach physicians this. I know that as you go through medical school and then you get to the place where, no, we need you to see more patients quicker. A lot of medical students, and they've measured this in studies, become more and more cynical just through the 4 years of medical school. And they went in to help people, and that's still an underlying thing that they want to do, but they're not as good at listening. And just that little connection, if a doctor can just establish a little bit of, oh, I hear what you're saying. That sounds horrible, what's happened to you. And wow, you've been through all that for the last 2 years and you're still getting up out of bed every day and taking care of your family and doing this and that. Just in those few moments, and I teach this to clinicians, you can establish a relationship with a patient very quickly just by listening and saying, I'm here. Okay, now that you see that I'm actually paying attention instead of going, oh, well, let's try this next. But you see, now, you know what? I've got there's some new neuroscience coming out. So there is a way that the clinicians, doctors and other clinicians can present this to people and not make them feel dismissed just by taking a few minutes and listening to them first. But that's something that is not encouraged and it's not taught.
But wow, what safety though you provide what safety you would provide in that moment to just see the person in front of you, but they don't have time. ultimately.
Right.
It's like they got 15 minutes. So,
right. And so I just want to tell anybody who's watching out there, this stuff is super, the pain or the discomfort or the symptoms that you might be having due to a problem that nobody's figured out, and that I'm calling, it's usually neuroplastic symptoms, meaning brain generated symptoms. These are usually worse than body-based symptoms. Very frequently, these are the worst symptoms we see.
Yeah.
And it's horrific and it changes lives, but there is a way out of it for people. But I just am acknowledging how awful this is. This isn't a little bit of like, oh, suck it up. You can't. It's not happening. Most of the people I see who have these problems, they know how to suck it up. I don't have to teach them coping skills. They've been coping with their crap for the last 2 years or 5 years or whatever. And most of them do get out of bed every day and get on with their lives to the best of their ability. Yeah. Most of them, the rest of the world doesn't even know they have this problem. The people close to them do, but that's called coping. That's not what I'm teaching here or what you're talking about here. Yeah. You have coping skills if you had this problem. I'm talking about rewiring these circuits so you don't have to cope with them anymore. And that's a different set of tools than gritting your teeth harder. Yeah. And I want to get into that with you. Because these are strong people. This is not weak people dealing with this stuff. So let's get into this work that you're doing now, because what an exciting shift to be able to actually help people, because you're helping people on such a deep level. Like sometimes this work is life or death. I'm sure you've seen that in your practice and the people that you've worked with that are experiencing this level of hopelessness. But talk to me about what your work looks like now, the type of people you help, the type of conditions you work with people to treat. What does that look like now in your day-to-day work? Yeah, I would say the vast majority of people that see me now have done the research. And so the due diligence has been done. Again, I see an occasional person who I'm like, really? I thought I want to do some other test before we go down this path. Again, I don't want to miss something. But most of them have done due diligence out the wazoo and seen already had way too many tests. And so from that standpoint, I'm certain we're not missing something terrible. It can be very valuable to some people. Not everybody needs this, to have a physical exam from some white-haired guy who actually seems like he knows what he's doing, and actually poke around. I had a woman who with a chronic back pain problem, and she's on my just sitting on my exam table. I'm just poking around. Is it tender here? Where's it exactly? It hurts. And she turns and she looks at me. She says, "You're the first doctor who's ever touched my back." This is somebody who's been struggling with back pain for 2 years. Now, somebody had to put a shot in it because she'd had shots and stuff. Yeah. But nobody had really said, "Okay, let's look at this." And just that, she's like, "Okay, wait a minute. Maybe this guy's going to, help me out." So just getting that level of establishing some level of trust like that can be really helpful. Not everybody needs that. I say this is self-care. Many people can look at the ideas of these ideas and go, "Oh, I can see this is what I have. I don't need a white-haired doctor to poke on me or tell me I get this." But other people can be really helpful to get some confirmation. So that's part of it, is just working with people to develop the first step is even understanding that this is something that could be happening or is probably happening in you. And that's sometimes a discussion. Sometimes it's an exam and a discussion. Sometimes it's just education of telling people, can you just look at this stuff and see if it applies to you? Because people know when if this resonates with you, the idea of having a hypervigilant nervous system, then this is something that you should do. And if it doesn't, I've let go of my previous need to fix everybody. Like, okay, I got to figure this out. I don't have to figure it out. I'm very blunt with people. I'm confident this is a neuroplastic problem, and this is in your nervous system and your brain, and I'm confident you can change it if you want to. But if that doesn't make sense to you, then it doesn't make sense to you. You're the boss of you. You know what makes sense, and that's fine. Keep going down, doing something else. Maybe you're right. I'm not God. I don't know. Yeah. So I bring that confidence, but I also I never tell somebody, "Oh, you have to do this." Then they're just you can't. Yeah, people have to come to it themselves. I can be part of helping them get there. So I'd say step one is just noticing or getting people on board and getting yourself on board with these new ideas. Again, that can be education. So you normally don't have to have people go through the FIT criteria, which was a system created to kind of run your symptoms through it and be do they behave in these ways, or do you? Oh yeah, I usually show that to people who are in that iffy space that we go through. Here's the FIT criteria. Here's some personality traits that that we see these personality traits more often, and people can sort of start recognizing, oh yeah. So the FIT criteria, where we're talking about pain, it's an acronym. FIT is functional, meaning that there's no good physical explanation for what's happening. Like, well, I have symptoms that come on only when the weather changes. I mean, that there's no physical thing that could be going on there, and if there is a physical thing, like, well, maybe I have a baroreceptor, a pressure receptor that in my body somewhere that can sense. Well, maybe you do. I don't know. We haven't identified it. But even if you do, that's still your nervous system is responding to this thing.
Right.
So it's not so much that you have some problem in your joints. I think running through those criteria and having people look at these ideas and come to it themselves. Oh, my pain my pain's worse in the morning than it is in the afternoon. Like, that doesn't make sense. If I have tissue damage, if I break a bone in my leg, every step hurts until I get the bone set. But if I put weight on a bone that's doing this because it's broken, every step hurts. It doesn't hurt in the morning and not in the afternoon. So these kind of variable symptoms, hurts when certain things happen. It's whenever I do this, it hurts. That's a trigger. Something is triggering this. And that's your nervous system has learned, oh, this is a problem. It's usually not a physical problem. So anyway,
just the way they behave. I had so many of those weird things. Like, sometimes it's here, sometimes it's here, sometimes it's the right foot, sometimes it's the left foot, sometimes the right knee burns, sometimes it's the left thigh. Just so bizarre. No one could ever make sense. I stopped going to doctors pretty quickly. I am curious what other diagnoses I would have collected when it moved to body-wide, But looking at those things and trying to filter them through, because that wasn't enough for me. I had to go so much longer beyond the FIT criteria to be like, it's got to be something, because this makes no sense. It's got to be something crazy. But by the time people find you, they've normally been like, they've gone through all the routes, they've seen all the doctors and specialists, and they are probably coming to you pretty convinced that I know what this is.
Yeah, many of them are convinced. Many of them are still in that nebulous space. Used to be, I used to take all comers. I opened a clinic with the hospital, and
oh, cool.
So people who came to me they're like, I said, what are you doing here? I don't know. My doctor sent me. I'm like, okay, we're going to start from square one with you.
Yeah.
But the people who see me now more have discovered me and have watched some things on YouTube or something, and so now they do come more with an idea that I think I have this.
Okay.
But there are people who, and I think, again, I'm really hopeful the paradigm is going to shift, because once this becomes a known thing and a standard thing, I'm hoping doctors will say, oh, okay, we did this, that, great. Oh, that means here's the problem. It must be this. And saying this not with well, maybe you want to look into this, but more, can the doctor start coming with a little certainty, like, oh, that makes the most sense to me.
Yeah, and it seems like it would be process of elimination, which what they'll normally do is give you some fibromyalgia or chronic fatigue syndrome, or, whereas what if the process of elimination was like, we've ruled everything else out. This is neuroplastic. This is nervous system related.
Is the hallmark neuroplastic kind of thing. It's definitely, so we could rename it, or we could just say, no, fibromyalgia is one of these things that absolutely should be treated this way.
Where do you go next? So because I know a lot of the things that you teach and that I teach, they overlap with allowing symptoms, getting back into your life. Like, tell me where you go with people once they're like, okay, I know what this is. I'm all in. Because I do think people kind of have to get to that place.
Right. So I like to show people, I have a diagram on that TED Talk. I have one other diagram somewhere in a video. But I often go through some sort of diagram. And what's happening here is that your brain is getting sensory. So we're going to start with the premise that there's part of a brain running your body, and that part of your brain outside your conscious awareness, and that part of your brain has one job and only one, which is to keep you safe and keep you alive, move you through the world safely. There's a large part of your brain devoted to just that. In fact, the number one thing your brain does, the most important thing your brain does, is not math problems or relationships with other people or your job or whatever. The number one thing, and by far the most important thing your brain does, keeps you alive. And without it, you won't be alive. And it's running everything about you. And so we have to understand there's a large part of my brain doing this that's outside of my conscious awareness that has one goal, keep me alive. And I'm going to stipulate for most of my patients that I see that part of the brain is hypervigilant. probably maybe from past experiences, it has become this way. Current experiences could be continuing to keep it this way. We don't have to dive into that right now. We just have to acknowledge, yeah, I can see I'm a little on edge. And in fact, this is an important point for people to understand, that if you don't feel like, no, I don't recognize that, then maybe this isn't for you. I like to tell people, sometimes I see people and I'm on visit number one, I'll stop them halfway through and I go, okay, John, I've heard 1/10,000th of your life story. I've heard this much, but just based on that, let me ask you a question. You ever feel like the other shoe's about to drop? Ever feel like, something might be happening here, a little bit on edge? If you responded now to me, John, if your answer to that question is nope, that's not me, then I'm thinking, really? Based on what I just heard about your dad or your history of cancer or your brother, that situation, you don't ever feel, what's wrong with your brain? You got a brain problem. There's something wrong. So what you have isn't a brain problem. What you have is a normal brain that has a learned behavior. There's nothing abnormal about this. No, it might not be serving you anymore, this hypervigilance that was useful when you used to have to walk on eggshells around whoever you used to live with or whatever. It might not be serving you anymore, but it's not a disorder. Let's retrain your brain, but let's not tell yourself you're sick or you're ill. You're not broken. You don't have something wrong with you. You don't have an illness. You have some brain circuits. They developed outside of your conscious awareness, not your fault. And that's an important part of getting better for everybody, is understanding that these are normal brain circuits and they developed without you. You didn't decide for this to happen. Your primitive brain decided to protect you, and this is not your fault. You can't get better if you're going to blame yourself for this.
Yeah, that's a big blocker. I think the combination of blaming ourselves and thinking that we're broken, like thinking that there's something wrong versus it's actually working a little too well. It's too hypervigilant. It's too sensitive. It's reacting to everything, and it's become this chronic thing. And I know we could open a big can of worms here, but I know you talked in your TED Talk as well about the anxiety side of it, the psychiatry side of it. I don't know if you want to talk. I'm definitely going to link your TED Talk in the show notes, along with everything else that you've talked about and how people can work with you and stuff. But talk to me a little bit about that, because that's something I'm also very familiar with. Felt a little bit disappointed and let down by. What have you learned about that?
So we're starting to understand pain. We've talked about pain as a learned neural circuit. But we're also understanding anxiety as that. So, and I just talked about how if you had to walk on eggshells, maybe when you were a kid, because I don't know, if somebody in your family was stressed out, that was your brain learned to do that. And you may just have learned to be anxious. But let me just step back, and I just want to clarify. I can talk about pain and switch to anxiety very quickly.
Okay.
I've just got this little spiel that really resonates with people. Okay. So the old neuroscience was that your body sent your brain a pain signal. Your brain said, thank you for the pain signal. I'll go get my Advil or my heating pad. But the new neuroscience suggests that, sure, the body sends signals to the brain, but it's your brain that decides. Is that signal dangerous? And if your brain decides that the incoming input is dangerous, then the brain warns you by creating pain. Pain's a protective mechanism. If I'm running and I break my ankle, I want pain. Yes, please. I hope I get it. It will keep me off the ankle so it can heal. So I now see pain as nothing more than my brain's alarm mechanism to let me know I'm in danger. If my brain thinks I'm in danger, it activates certain neural circuits to create for me the experience of pain to get me out of the situation. Anxiety works the same way. If I'm in a dark alley at night and I hear footsteps, I want anxiety. Yes, please. It's called the fight or flight response. A lot of good things happen. My muscles tense up. Doesn't feel very good, but I'll react a lot more quickly with tense muscles. My heart pounds through my chest. Doesn't feel very good, but I need to pump some blood for fight or flight. Yeah. My stomach might get gurgly. That's my autonomic nervous system shunting blood away from my gut. I don't need to digest food right now, and towards my large muscle groups for fight or flight, which is why so many people with anxiety get GI problems. And my autonomic nervous system up here is going, you know what? We need more oxygen. I got to get you to breathe faster. And I don't know how, I can't tell you to breathe faster. I'm the primitive survival brain. I'm your lizard brain. I don't have any words, but I do control the body. You know what I'm going to do? I'm going to put some pressure on your chest and tighten your throat. That'll make you breathe faster. Right. So if I'm in this dark alley at night with all these symptoms, and if I turn to my lizard brain and go, what the hell are you doing to me here, dude? I mean, my muscles are all tense. My heart's pounding through my chest. I'm nauseated. And I'm short of breath. Could you stop it? Again, it would say, I don't give a shit how you feel. I'm trying to protect. I'm trying to save our life here, not trying to make you feel good. This is how I work. So we're starting to understand both pain and anxiety as protective alarms from the brain to the body. At root, they're good things. I need them both. I want them both. Neither one feels good when they keep running after the fact. And they keep running after the fact if you've had to do this for more than a little bit of time because your brain has said, hey, this is good for me. It's developed a learned neural circuit to keep you like this. And so many people are stuck in that learned neural circuit, not a disease. It's just because that's how brains work. Now that we understand that, we can step back and go, oh, that's the problem? Oh, well, how do I rewire it? And we have tools now to rewire this part of the brain, but it's not thinking tools. It's not psychotherapy. This is not happening in the thinking part of your brain, or you would have thought your way out of it yesterday. There are many, many people here. They're very smart. They figured themselves. They don't even know. I can see why my brain's doing this. That is, you do need to kind of I like to say you need the captain of the ship on board here. You need your cognitive brain on board to get these concepts. But understanding the concepts intellectually, that doesn't get you anywhere. That's just step one. Now we need to train this part of your brain. And this lower part of your brain doesn't learn by reading books and watching lectures. This lower part of your brain learns by experience and repetition, which is how my autonomic nervous system got the way mine is, and how yours got the way yours is, a lifetime of experience. So having the understanding is important. I always like to say that if the captain of the ship doesn't understand these concepts, your crew will never get them. But understanding them intellectually is step one. Now we got to train this brain, and this brain we're going to train with a different set of tools. And the tools we're going to use to train this part of the brain are body-based tools. We want to get into body language. That is the language of the autonomic nervous system. All day long, sends and receives messages to and from the body. We want to become more comfortable with our body sensations and start doing exercises that involve being with our body sensations. If we want to change anxiety circuits, pain circuits, these things that are happening, all of these things are happening in this autopilot part of my brain that I don't have intellectual access to.
Yeah. The one thing I want to talk about before we get into what those practices look like for you and the patients that you work with is, as someone, and a lot of my audience is this person as well, that got stuck up in my head for 20 years. I don't think you need a basic understanding of this. And oftentimes we get stuck there and we're just learning everything we possibly can, which essentially keeps us in our head. It keeps us stuck. It's a false sense of security when we're like, I just need to figure this out. I just need to understand it. What are they saying? What are they saying? Do you agree that you need you need a fundamental basic understanding, and then you need to get out of here and you need to get into here. And we need to start doing experiential things that are I like to say, let's show versus tell, because there's so much out there about like, tell your brain you're safe. Like, you're safe, you're safe, you're safe. It's like, I got this. Don't worry. Like we're freaking out. So I want to know your thoughts about that. As far as, I would guess that if you work with anxious patients, you see a lot of them get stuck there for maybe too long, longer than they need to.
Yeah, absolutely. And a lot of times these people are good at figuring stuff out.
Yeah, it's a problem.
They're very good at figuring that. I often say we need to get out of engineering brain. Yeah. Because sometimes or frequently it's engineers or people who think it can be any of us though, trying to figure stuff out. And you're not going to figure this out. This is not happening in that part of your brain. Yeah. So there is a tendency to keep wanting to figure it out. I think what we have to do is acknowledge that there is this new thing going on. There's this new understanding of how brains work, and I'm not going to fix it by figuring it out.
Yeah.
I have to let go of that. So I like to say we want to get out of fixing brain and into allowing brain. And once we allow these symptoms to happen, instead of try to fix them, every time you allow the symptoms, you're teaching the brain that it's okay to allow them. You're teaching the brain that the symptoms aren't dangerous. So we do have to have that fundamental first understanding that the symptoms themselves aren't the sign of some dangerous body tissue problem going on, even though it feels like it. But once you have that understanding, how do you transmit that intellectual knowledge? Okay, I have neuroplastic symptoms to the body. And that involves getting out of fixing brain and letting go of that. And sometimes that's the main thing people need to work on.
Yeah, I agree.
My brain just won't shut off. I just keep it. And there are some exercises that you can do with people that really have nothing to do with pain. They just have to do with, can you turn your brain off? Can you get out of this perpetual worry and catastrophizing? And that can be very difficult because you can't will your way out of it. You can't, those are also, that's just a cycle that's happening at a lower level of your brain. And you can will your way out of it for 10 seconds and then the thought comes right back. So there are people whose one of the main things they need to work on is calming down that hypervigilant brain. Even though I'm talking about, we need to turn to the body, there are some brain-based exercises too, because it's all connected. This isn't
it is
body therapy or mind therapy.
And I think it also so depends on the person as well, because I feel like there's so much emphasis out there on brain retraining. And what I found was similar to what you teach, like allowing and accepting did so much more for me than these very structured things, because the structured things kept me up in my head. And what I love is that we're not avoiding the brain retraining. The brain is being retrained, but through the body and through experience. So rather than like interrupt every thought and stay really up here, which someone like me who like loves to figure stuff out was like, oh yeah, I can do this all day. But that was just me staying out of where we needed to go, which was your brain's going to rewire itself. It's another one of those things that we try to get really involved in, but it's like, let's let the brain rewire by showing it something else, by allowing this stuff to exist without our interference.
Yes, once you understand that this is how this part of the brain learns, and you are not going to make it learn faster by reading another book or telling yourself something, saying these words out loud over and over again is not going to change it, that you have to actually do something. Once you understand, that's how this part of the brain works, and I can't make it change. The part of the brain we're talking about is the same part of the brain that when I talk about brains developing habit loops, and your brain, if you do something over and over again, you get good at it. You're learning to hit a tennis ball. That essentially what happens is you are firing neurons in a certain order so that your body moves this certain way. And you practice it over and over. Neurons are fired together, wired together, and your brain learns, okay, I need to put the neurons together in this way to make all my muscles move in such a way. And you get better gradually. You don't do the exercise on day one and go, okay, I'm a pro tennis player. Yeah, I practiced
Never.
it. And that's the part of the brain we're trying to train here. Same thing. We don't say, oh, I just want to retrain that part of the brain. Oh, well, let me do an exercise and see if I calm it down. Oh, yeah, that worked. Or no, that didn't work for me. We relax into the process. We take a tennis lesson once a week and we go out and practice the other days.
Yeah.
And then sure enough, 6 weeks later, I'm better. Still not perfect. I still need to keep going and practicing this. But we need to practice this. So this is I often start some of the classes I teach. One of the early slides I show is a picture of a brain holding a toothbrush, brushing it. So this is mental floss. And nobody comes to me and says, why do I have to brush my teeth every day? And what is that? I mean, if I don't do it, my dentist and my dental hygienist tell me that something's going on here. What's wrong with my teeth and gums? Nobody asked me that because you were taught when you were 2 years old. When you were 2, somebody shoved a toothbrush in your mouth. And when you were 4, 5, and 6, they hovered over you. And when you were 10, 11, 12, they yelled, have you brushed your teeth before bed? And now you just do it. Right. And yet people come to me and go, why do I have to do exercises for my brain? What's wrong with my brain? There's nothing wrong with your brain. This is called mental floss. We should be teaching this in elementary school and in middle school health class. Here's how you keep brains healthy. Here's what you do. It's a little something every day. It's a few minutes a day, just like brushing the teeth. I don't do it all day long, but you do this a few minutes a day and your brain starts learning, oh, I can run in this mode with a little higher parasympathetic tone, meaning relaxation tone. I can do that. I didn't know that was okay. But you do it over and over again, and your brain starts learning to run in a different way. Pain signals calm down, anxiety signals calm down.
Yeah, it makes perfect sense. It's just like everything in life. It takes time. Like you said, it takes repetition. It takes doing it over and over and over, because I kind of like to think about it in forms of like trust and like building a relationship. Like it takes time, and our nervous system is just doing the best that it knows how until it learns something new over and over. So I have $1 million question for you when it comes to allowing your symptoms. The number one question I get is, how do I do that? What is your answer to that question?
This takes some training or takes some practice, but we can, again, sometimes the exercises can seem a little formulaic. We have to let go of the idea that the exercise is going to fix us. Right. That's not what we're doing. We're not doing the exercise to go to nirvana or feel better. We're doing the exercise to have the sensation, to show our brain that we can have a sensation without being alarmed by it. I talk about the pain-fear cycle, how your brain has gotten into the sensation comes in, the brain goes, oh crap, not that again. What does the brain do saying, oh crap, not that again? It sends more protective alarms to the body, more tension in the muscles, more anxiety symptoms, more back pain, more headache pain, whatever the stress symptom it has discovered. This is a brain that has discovered that, oh, whenever I send that signal, Brad gets uptight, and I think it's good for Brad to be uptight. I think we need to stay in this thing. The headaches keep him in this hypervigilant state. Let's do that. So your brain has discovered this pain-fear cycle. It's stuck in this pain-fear cycle. We want to change the cycle. We want to get it into, instead of sensation, sensation, we want to teach it. I want to show you, brain, we can have sensation without the And we're going to practice this. Let's practice having a sense. Let's first practice any sensation without an Can I just show you how you can watch a body sensation without And this will be easy because it's not even your pain. But let's practice this. So I often start with exercises that have nothing to do with pain.
Okay.
And it might be a very simple, this is a 15-second exercise to just demonstrate to people. How do you have a body sensation looking at it with a kind, non-judgmental attitude? And everybody could do this right now.
Yeah,
you
for
can
sure.
join me here.
Okay.
The only criteria for this little 15-second exercise is that your hands are not touching each other.
Okay.
And what we're doing here is we're getting out of the pain-fear cycle. We want to teach the brain, I can have a sensation and I'm going to look at it differently. And what we're going to do is we're going to watch the sensation mindfully.
Okay.
Mindful, if you look at the John Kabat-Zinn definition, mindfulness is paying attention on purpose in the present moment without judgment. And you can take classes on this. You can go take mindfulness classes. You can go to retreats. And I'm a fan of all that stuff. If that appeals to you, I think that can be really helpful. But everybody on the planet can become mindful like this when we invoke curiosity. Curiosity is the hack to mindfulness. It's the shortcut. Because when I'm curious about something, I'm looking at it on purpose. Mm-hmm. I'm in this moment. What's going on there? And I'm not judging it.
Yeah, detachment. Yeah.
So we can all use this to become, so this is an exercise where we're going to use curiosity to become mindful about your hands.
Okay.
And it's going to take 15 seconds.
Okay.
Right now, again, just hands touching, not each other, but anywhere else. It can be in your lap, on an armrest, doesn't matter. And ask yourself, pay attention to your hands and ask yourself, does one hand feel warmer than the other one? Can you tell any difference? And I know from experience, most people can't. They're like, what? And if you're in that group, you're like, 50-50 is an acceptable answer, but open your awareness. You sure it's not 55-45? Just play with it. And if you're one of those people, and this is usually about 10-15% of people who immediately like, yeah, my left hand's warm. If you're somebody who immediately recognizes it, then ask yourself this question. On the warmer hand, which finger is the warmest? And which one is the coldest? And many people are still in I can't tell my hands. We're now done with the exercise. That's it.
Okay.
That's a full exercise. So that was 10-15 seconds of mindful awareness of the hands. We looked at them on purpose. We stayed in this moment, what's happening there, and we didn't judge. Discernment, left versus right, no judgment, good versus bad. So this is the kind of attitude we want to start bringing to painful sensations. But it helps people to just practice with non-painful ones because it can be difficult with pain. Let's just start with any sensation like your hands and ask yourself a question. We're just using curiosity to become mindful about a sensation. And I have a few other short exercises that have nothing to do with pain before I often now let's move to a difficult sensation. Can we apply the same wide-eyed curiosity? What's going on there? And you notice that was not an intellectual exercise. That was a feeling exercise. We want to get out of thinking brain into feeling brain. What do I feel here? And I know from experience that a lot of people I'll say, how'd that go for you? And sometimes people will say, well, I did notice that my left hand was warmer. And then I started thinking, what's wrong with the circulation in my right hand? These people went to judgment immediately. And that's a good thing to notice about yourself. Oh, you're very quick to worry and judge about that. Okay, that's what we're trying to get away from.
Yes.
And just noticing that can help people. Let's see if we can do that again. And just notice, this one, two. And so you can practice being, watching something on purpose, staying in this. I have other people who don't stay in this moment. They're like, okay, you know what happened to me? I was watching that. And as I did it, I remembered that I had injured my finger last night. And then I started wondering if it was getting okay. Well, they're not in this moment. They went to last night because they hurt their hand or something. So, but that can be a helpful part of the process to help people see, okay, I see what I'm missing here. I always go to a different time, or I worry about whether it's going to feel like this tomorrow, or I'm wondering right now, is my circulation wrong, or what's wrong with the nerves there? The big difference here is that traditional treatment of anxiety, traditional treatment of pain is I need to get away from it. We need to find something to stop it, whether that's a pill or a psychotherapy or something. We need to, and the difference with mind-body medicine is we recognize that these are just normal circuits in a brain. They're not serving you anymore, but they're not an illness. They're not something we need to find a pill to stop. We want to retrain the brain. And so instead of running away from symptoms, be those pain symptoms or anxiety, we go towards the symptoms. We recognize that running away from them is just sending a message of danger to the brain. I got to get rid of this. So we want to, and a lot of the day, of course, we want to run away from. Of course, we want to ignore them and say, I'm going to put you in the background and get on with my day because I got a day to live. That's fantastic. Good. That's called a coping skill. Yes. Put it aside, ignore it, distract yourself, get away from it, try to fix it, grit your teeth and move through it. You're going to have to use those coping skills at times. But we want to spend a few moments every day doing something different than coping with it. We want to spend a few minutes a day having the sensation and showing the brain it's okay to have this sensation. And you don't have to do this all day long. You can't do it all day long. But a few minutes a day, I'm going to turn towards the sensation and just get curious about it. And watch it in the same way I watched my hands. And this can be something people can practice. You can go Google now, somatic tracking. You can find people who walk you through this all over the internet. And we just practice this, and then we relax into the process. Well, I just did that, and it didn't fix me. I know it didn't fix you. It's not supposed to fix you. It's supposed to train the brain. It's a brain
problem.
It's a brain training exercise. And the brain will learn. And we relax into this any more than if I'm trying to strengthen my biceps muscle, I do some curls. I do 3 sets of 10, 2 or 3 times a week. But after the first set of 10, I don't go, oh, that didn't fix it. No, I do the program. 6, 8 weeks in, I want to check in and go, is this working? If it's not, if I don't notice any change, time to sit down with my trainer or myself and figure out what am I doing wrong here. But we're not going to check in obsessively every day and say, does this work? Does this work? We're going to relax into the process. This is how you this is how you get a bigger biceps muscle. This is how you rewire a brain. You do these exercises and you see what happens over a few weeks. So this relaxing into the process, which can be very difficult because we want to get better. And so I like to tell people that, and that can be hard to let go of. So I like to tell people we're going to keep 2 contradictory ideas in your head at the same time. 1, I want to get rid of my pain, or
of course,
reduce my anxiety or something. Duh. You don't want to get rid of problems like this. Who wants to feel like this all the time? But the second idea, contradictory to that we're going to keep in our head at the same time is not today. That's not today's goal. Today's
100%.
goal is, can I deliver messages of safety to the brain? And can I deliver authentic body-based messages of safety to the brain? And if I did, I had a successful day. Success is not less pain or less anxiety. Success is, did I deliver some messages of safety to the brain? And if you did, you pat yourself on the back. I had a successful day. I'm going to do this again tomorrow. I'm going to see what happens over a few weeks.
Yeah. The 2 things that you mentioned, the is it working and did I fix it, are like the 2, if anything is being done from it, is it working or did I fix it? We don't really understand what we're doing because it is essentially brain rewiring. Like we are. And so that's the goal. The goal is to respond or to not respond how you normally do with fear and focus and fixing and attention and panic and urgency. All of that is rewiring. We aren't really looking to fix or make it work. It's another one of those things that that'll take care of itself. We need to focus on what we're focusing on here, which is a new response ultimately through the body, not the brain.
Yep.
So I love that.
Yeah. And I know we're at the end time here. I have to answer one other thing because we have left out, and this is just because there's a lot of stuff to cover.
Of course.
We have left out one really key thing for many, many people. I like to say there are 2 things that keep the brain in this hypervigilant state. One of which is this pain-fear cycle that's just got the habit loop that the brain has gotten into. And we practice getting out of that with these certain tools of watching sensations differently and responding to them differently and showing the brain that we can respond to them. So that's one part of neuroplastic retraining. It's a big part. And we call that part pain reprocessing therapy. But there's a whole other area that keeps the brains hypervigilant. And that's what I call under the hood stuff. This could be emotions that are underneath and keeping you like this. This could be PTSD, people who are still, their body's still holding on to something. It could be thoughts, your thought patterns, your negative thoughts. That can keep the brain hypervigilant. And if I do have a pain fear cycle running, a habit loop running over here, if I'm hypervigilant for these under the hood reasons, I'm not going to be turning them off. So, under the hood emotions, they might be repressed, meaning you don't even know the emotion is there. And there are ways to get that out, but it doesn't have to be. Any emotion can keep me like this. So I see people who, an example of an emotion that might be keeping your brain like this is anger. And I see people who say, yeah, I'm angry, and I'm not repressing it. It's like, I know it's there. It's not so far buried. I'm pissed off at this guy or this situation, but what am I going to do? Write a nasty email. I'm not going to punch somebody in the nose. That's not who I. And in fact, if I wrote that email, what would happen to my job or my family dynamics? I'm not going to write that email. It's totally screwed. No, I'll keep it under the hood. You may be able to keep it under the hood. Your autonomic nervous system knows you're angry. And when I'm angry, I'm hypervigilant. If I do have an alarm running, I won't be turning it off. So one of the central precepts of mind-body medicine is getting out what's in. And there are a number of ways to get these things out that don't involve psychotherapy. Then that's sort of maybe a discussion for another time.
Yeah,
but that is a big topic. There are a lot of people who can get a little frustrated with just the brain retraining. That can be all that some people need, but there is a whole nother avenue to explore of stuff going on under the hood for some people.
I totally agree. Okay. Well, thank you so much. I've just loved having you here. I've loved having this conversation. I'm sure we could talk for 8 days. We won't today. We're going to wrap it up, but I just appreciate your time, and I'm going to put all of your information in the description. I know that you do classes, you do group classes. People can work with you one-on-one. You have wonderful content that you're putting out there. As we wrap it up, is there one final thought you want to leave everyone with? And for people who are desperately seeking answers, searching for something, like what do those people need to hear?
I think different people need to hear different things. Yeah. But I guess if I think of two things, one, this is the new neuroscience. If you're reluctant to embrace these ideas because you think there's not enough data or there's no science behind it, you can, if these ideas don't sound good to you and that's the reason you're not embracing it, you think there's something else. But if you're telling yourself that this isn't science, you're sadly mistaken. This is the new neuroscience. So open up your head and start reading about it. Just because your doctor doesn't maybe know about it doesn't mean it's not the new neuroscience. It is, and you can hear neuroscientists talk about this. There are places to watch them do that. And then I guess the second thing that's just so important for so many of my people, I did say this earlier, but I just want to say it again, that these are brain circuits. When I say these are brain circuits, I'm not saying it's all in your head. I'm saying that these brain circuits control your body on a very physical level, and they developed outside of your conscious awareness. And an important message for many, many people, I'm going to say it again, that they need to hear is not your fault. That is super important for a lot of people to know. Not everybody needs to hear it, but I know a lot of people do. Because when doctors are scratching their heads, there's a little bit of eye rolling, like, I've done my test, why aren't you getting better? And you can there's a little bit of maybe recrimination from them. There's a little bit of self-blame. And that is not what's happening. And in fact, that's a barrier to success. As long as you're blaming yourself, you talk about keeping your brain under pressure and under stress, telling yourself that you're doing the bad job or that you're wrong or that, this is your fault. That keeps it like this. So we got to lose that notion. This isn't your fault. There's a way out of this.
I love that. What a wonderful message to leave this off on. And I know there are a lot of people that needed that message for sure. So thank you so much for joining me on the podcast. And thanks for everyone who listened. Would love to hear what you guys thought about this conversation. And we will see you next week. Bye, everybody.
Bye-bye.